Hello and good evening. I'm Melisa Idris. Welcome to Consider This. This is the show where we want you to consider and then reconsider what you know of the news of the day. The government has recently deferred the amendments to the Drug Dependants, Treatment and Rehabilitation Bill to the Parliamentary Select Committee on Health and Security. Now, the first reading of the bill had recently been tabled and had received significant opposition from medical professionals, civil society groups, and some lawmakers who argue that the bill, as it currently stands, lacks crucial medical oversight in the rehabilitation process. So joining us now to help us better understand some of the concerns surrounding this bill is Dr Sangeeth Kaur. She's the co-chair of the Expert Advisory Group on Drug Treatment and Rehabilitation in East and Southeast Asia under the United Nations Office on Drugs and Crime. Dr Sangeeth has long been an advocate for drug policy reform in Malaysia. Dr Sangeeth, thank you for joining me on the show today. I appreciate your time. Can I get your thoughts on the first reading or the proposed amendments to the Drug Dependants Bill that was recently tabled in Dewan Rakyat?
Hi Melisa, thanks for having me back on again. So there's been a lot of changes from our last discussion. I must say, I think we have come a long way from treating people who use drugs as we used to call them Sampah Masyarakat or criminals, to actually accepting them as patients who need treatment and rehabilitation. I think this was evident in the last Parliament session, where we had a huge response from MPs and interest, and using terms like decriminalization, using terms calling them patients. I mean, that I think is a huge step forward in treatment and rehabilitation in our country. However, I must stress that the amendments that were recommended contradicts the principles of decriminalization, and it lacks scientific evidence. We want to get it right this way, and we want to make sure that decriminalization is diverting them from the criminal justice system to the healthcare system. What we saw in the bill is that the bill puts a huge amount of emphasis on still punishment. You know, if you do not comply with treatment, you still have, you can still go to prisons, prison sentences, fines for people who use drugs, and in some cases, even for parents who do not take their kids for treatment rehabilitation, up to 5,000. So this is not keeping with the principles of decriminalization. And there is also a grave concern with the bill, because it is not, it is conflicting with the present other drug acts, like the Dangerous Drug Act 1952. And the new bill contradicts the Dangerous Drug Act. So we can't amend the Treatment Rehabilitation Act without amending the Dangerous Drug Act. So it is important to look at all the acts that are related to drug policy or the laws to have a comprehensive drug policy which decriminalizes people who use drugs. Right. So I think that was the key points. And also the bill does not show any scientific evidence around addiction and understanding the issues faced on the grounds by parents, people who use drugs, and using experts to come up with evidence-based programs, treatment programs, because if we are going to decriminalize, we can't make the mistake of decriminalizing without having a good treatment rehabilitation program in the community, because the whole thing will fail. So we need to expand, strengthen the program on the ground before we can decriminalize. And also we must remember that drug use dependence is multifaceted. It is not purely a psychosocial problem that it can be treated by rehabilitation officers. It needs close collaboration with medical experts, psychiatrists, health officers. And what we have seen in this bill, it seems to have alienated the role of Ministry of Health and its officer. And finally, I think this bill gives too much of power to the Rehabilitation officers who is not sufficiently trained to deal with dependency. And this can be dangerous, to the health of the individuals, and also can lead to abuse and corruption.
Right. Dr. Sangeeth, talk to me about, so when you say that it contradicts or isn't quite in line with the principles of decriminalization, has an emphasis on punishment, talk to me about what it was that you wanted to see in the bill. So we have this kind of first draft, the amendments, but what was it that you were looking for in the bill that you didn't see?
Yeah, so if we are going to remove, for example, if one of the sections, so Section 8, that they want to amend is where anyone who uses substance can come in voluntarily for treatment at rehabilitation centers or for subservienties. But although we say that it's voluntary, once they come in there, they still undergo 6 months of mandatory treatment. And they might still have a criminal record. So, and that is if they come in voluntarily. At the same time, the Dangerous Drug Act 1952 says in Section 15, if you have consumed or you've put any drug in your body, you can be charged in court and sent to prison by the police. So they are both contradicting. So you can either, if a policeman stops someone, like, which do you use? If he says that I want to go to voluntary treatment, or will I be charged in magistrate? So both these laws are contradicting. So holistically, what we want is definitely, if we are going to decriminalize, is to make sure that we do not, they are not channeled to a criminal justice system, but are directly diverted to a healthcare system where they can get treatment and rehabilitation without any punitive measures.
Right. Is that where you see the role and the involvement of the Ministry of Health?
Yes, definitely, because substance use, drug dependency, it is a very complex problem, and is currently under the specialty of psychiatry. Drug addiction falls under psychiatry, and they are the experts who treat substance use in hospitals or in. But I think medical officers are being trained, are able to also manage drug dependency. But also, I want to emphasize that not everyone needs treatment. So, like I said, it's very complex. They need to be diagnosed by experts, by medical doctors. Are they just regular? Are they just recreational users? Are they abusers? Are they dependent? And accordingly, then we need to refer them for treatment.
Right. So, Dr. Sangeeth, is it a good thing that this bill has now been referred to the Parliamentary Select Committee? I'm wondering whether you think the PSC, what next steps for the PSC now? Should the PSC prioritize more consultation, refining the bill, take their time, study, focus on the scientific evidence that you pointed out a bit earlier? Or is there an urgency to get this bill passed, to get this legislation tabled in any shape or form, and then we can deal with the consequences later?
No, definitely not, because we want to get it, because we have been doing this for the last 40 years, and we have done a lot of good work in the country. We've done a lot, like the harm reduction program, the cure and care clinics. There's a lot of good work that's been done by NGOs on the ground. What we need now is to collaborate and identify the best practices, get the experts together. I mean, there's the main categories that we see is the legal fraternity, medical team, and the community. So we need to have consultation with all these three groups. The do a proper legal review, to have consultation with the medical Ministry of Health, so that we can expand and strengthen the treatment program in the country, so that it's easy for anyone who has a substance abuse problem to access treatment. That is very important. We need the legal review to look at all the laws again, all the different acts. There are 3 or 4 acts that need to be reviewed. And then we need consultation with the community, because they are the people who are affected on the ground, the families, the NGOs, the people themselves who are the victims. We need to talk to them and see what's best. So yes, this free consultation is ideal, and that's what our group at Drug Policy Program Malaysia is trying to do, to have all this consultation. Hopefully, we will be able to help and work with the committees to have these consultations, to come up with a comprehensive, accepted program, and even before we go full force, probably to have some pilot project to start off and to study how it could work.
Well, there have been international examples of pilot projects and in community the way it's been implemented in the community. Do you look to other countries or other communities that have tried to do this and succeeded?
Yes, so we have looked at many of the, sometimes they say that no, we cannot implement Western policies in Malaysia, because yes, I agree that we need to look, but we need to pick and see which, because there's a lot of evidence. Countries have been doing this for many years. So I think there's enough evidence or best practices that we can adopt. So, I mean, we can take the things that are suitable to our country from Portugal, because they have done this for many years and it's worked for them. And in Malaysia, we had such good pilot projects like the harm reduction program. It is recognized internationally as a best practice in Malaysia, because we managed to bring down HIV among drug users, and for them to be socially functioning in the community. It helped reduce drug use with the harm reduction program. Then ADK themselves, in 2012, I was involved. We started the cure and care clinics, where we converted the Pusat Serentis to volunteer-based centers. And we had overwhelming response, and it was a very good concept, where we had rehabilitation officers with medical teams who were helping. But the reason why we could not sustain these programs, best practices, is because of the law. Mm-hmm. The laws were not changed, the laws were not reviewed. So although we have all these best practices, that same person who walks on the street can still be arrested.
Right. So that's why it's so important to get the amendments to the legislation right.
Yes, exactly.
Dr. Sangeeth, thank you so much for speaking with me. That was Dr. Sangeeth Kaur. We're going to take a quick break here on Consider This. We'll be right back. Stay tuned. Hi, welcome back to Consider This. I'm Melisa Idris. Let's continue our discussion about the amendments to the Drug Dependants Treatment and Rehabilitation Bill, which has since been deferred to a Parliamentary Select Committee for further refining. This after the bill received strong objections following its first reading that the amendments were not in line with a medical-focused approach to addressing drug addiction. So joining me on the show now is Dr Azizan Abdul Aziz, President of the Malaysian Medical Association. Dr Azizan, thank you for being on the show with me today. I'm wondering whether we can begin our conversation today maybe by you elaborating your primary concerns that you have with the amendments to the Drug Dependants Bill.
Thank you, Melisa, for inviting me to the show. Right. Our chief concern is how these cases of drug dependency are going to be handled. See, how the cases will be assessed and treated. Will they be in line with best practices? Because substance or drug dependence is a medical and health condition which needs to be treated by a medical practitioner, or rather psychiatrists or psychologists specializing in managing addictions. So we have to get the diagnosis right so that the right treatment can be given to the individual for us to get a successful outcome of it.
Right. So MMA has expressed concern specifically about the role of rehabilitation officers under the new bill. Can you talk me through why you think that rehabilitation officers, or in fact, sorry, let me rephrase that, why you think medical professionals ought to be the people handling rehabilitation?
Okay, as mentioned just now, drug addiction or rehabilitation, it is a medical condition, right? And it is a relapsing problem. So we appreciate the role of the rehabilitation officers in the care of people who are dependent or misusing drugs or substance. Okay, they have a role to play here. However, doctors, they are trained to manage patients as a whole, which means in addition to diagnosing the main medical issues here, which you think is a drug dependence, we also identify other medical issues that are present, as well as identify the psychological or social issues that are present. So without trained personnel managing these cases, there can be risk of issues like misdiagnosis, and as a result, wrong treatment being prescribed. So the underlying mental health issues might not be picked up. For example, depression is a common condition that is associated with an increased risk for other chronic health problems. As you know, non-communicable diseases is prevalent here in Malaysia, so including the substance abuse. So in such cases, the depression will need to be managed alongside the addiction.
Right. So even though the Home Minister has already said that some rehabilitation officers have these qualifications, they have been trained in the field of psychology, of counseling, of clinical psychology, does that not allay some of your concerns that they don't have medical training?
As I said, Melisa, this is a medical condition, right?
So it's not enough to have just training. Okay.
Yeah. The other diseases you have to know is not, or else they are just focused looking this drug addiction. Everybody that they see has got this symptom is drug dependent issue. They don't see the whole picture, or they might be blinded by things, might be overlapping. Somebody might have, a few conditions happening at the same time, right?
Right. So rehabilitation officers now are under the purview of the Home Ministry. So by bringing in medical professionals, that would bring in the Ministry of Health. Is that where you see the role of Ministry of Health in helping deal with drug dependency?
Yes, definitely. Ministry of Health has got to play a big role here. Of course, the Home Ministry has got also their role, but the Health Ministry has got a bigger role. As I said, it is a medical condition.
Okay. So talk to me about what other changes you would like to see. So that was one of the main concerns, having non-medically trained rehabilitation officers largely decide the outcomes for drug dependence. But what other concerns did you have with the bill as it stands?
Well, the definition that was given. So if you don't get the definition right, you are not going to get, the management also right. So the definition that they gave was something like menjejaskan kawalan sendiri, loss of self-control, which is not correct.
The definition for
substance or drug dependence, because that's what we're talking here, right? So it's not about their losing self-control. There are many aspects of it. So by right, it should be the accepted definition of the substance dependence should come from the Diagnostic and Statistical Manual of Mental Disorders, 5th edition, or for short, we say DSM-5, where there are 11 criteria. And you need more than more than two criteria within a 12-month period, whereby you can categorize them. If they are mild, there's 2 to 3 of the criteria, moderate 4 to 5, and severe more than 6. Okay. Okay, let me tell more on the criteria. Okay, so I need to refer to this. All right. To be diagnosed with substance use disorder or drug use disorder, an individual must be at least 2 of the criteria within the 12-month period. So what are they? One is impaired control. Impaired control means there are 4 criteria under impaired control. The substance is often taken in larger amounts or over a longer period than intended. 2, there is a persistent desire or unsuccessful efforts to cut down or control substance use. 3, a great deal of time is spent in activities necessary to obtain, use, or recover from the substance's effects. 4, craving or a strong desire or urge to use a substance. This is under impaired control. Then we have the social impairment, where there are 3 criteria. What is it? It's recurrent substance use resulting in a failure to fulfill major role obligations at work, school, or home. Continued substance use despite having persistent or recurrent social or interpersonal problems, important social occupation.
Right.
Yeah, there's a lot. Sorry.
Okay. So the DSM-5 definition clearly specifies all the criteria for diagnosing substance dependency. This was not included in the bill. Is that correct?
Yeah, that's right.
Okay. All right. So let's talk more about the need for this bill to change. We have it now in the PSC. Dr. Azizan, how important do you think is this period now, this refinement period, and what role would MMA play in helping consult or engage with the refinement of this bill?
I think for the select committee to have a psychiatrist as one of the member would be great, because then they can look the overall, and they are the best to me to be in this, for us to handle this drug dependence issue in this country, because you have to look it holistically, every angle, that is the medical side, social and everything. Then we've got other support groups. We have to look at it holistically. Yes, so I think a psychiatrist being one of them would be great.
Right. And what can I just ask? What you would like to see in this bill to ensure that it aligns with a medical approach to dealing with substance dependency?
I think under the act, they have to put in again the medical, what do you call it? The role has got to be bigger for doctors. So they have to mention somewhere in the act, it has to be under, what you say, a medical practitioner. Mm-hmm. A medical practitioner somewhere that they should be, in the diagnosis of it. I think a medical practitioner has got to be there before it goes out to the ROs.
All right. Well, Dr. Azizan, thank you so much for speaking with me. That was Dr. Azizan Abdul Aziz from the Malaysian Medical Association, wrapping up this episode of Consider This. I'm Melisa Idris, signing off for the evening. Thank you so much for watching, and good night.